I'm not a nurse, but...
I'm not a nurse, but... I'm not a nurse, but...
I'm not a nurse, but...
I'm not a nurse, but...
I'm not a nurse, but I used to be. Unfortunately, my career ended as I have to stay at home to look after my 2 children with complex health needs.
I'm not a nurse, but I do deliver a lot of nurse, specialist, service and support and care to my daughter who has complex health needs. I also provide training to her carers. I'm not a nurse, but I provide a really high level of care to my daughter Hannah, who's 14 years old. She needs 24-hour care, and every day the care she's given is equivalent to the care given on a high dependency unit in a hospital.
I'm not a nurse, but I am Holly's auntie. I'm also a carer.
I'm not a nurse, but I'm mum to Harry, who's 8, has complex health needs.
I'm not a nurse, but I look after Jack. He's my son. He was starved of oxygen during the birth. We look after him at home, making sure that he's well, making sure that he stays out of hospital. Jack's got a tracheostomy, which has been quite hard for us to learn, but being a parent, you just have to do these things.
We're really well supported at home. We have a WellChild nurse specialist who becomes involved when any problems come about. We also have at the moment, are well supported with a good care package, which took a long time to get to, but we're there.
I do need the help of other services like the physios, the community nurses, the OT and the care package that I've got. If I didn't have this support, Hannah wouldn't be able to live at home and enjoy all the things she enjoys. I feel things that would make my life easier to care for Jessica at the moment particularly are around training needs. We get direct payments, and those people are there to help us, support us caring for Jessica, but the training, there isn't any in our area. So again, I'm providing training to these people, which I just would love to be mum one day and for somebody to come in and support me as mum and not me as carer.
What would be fantastic to help me support Holly's mum and dad and to care for Holly would be to have access to equipment so that Holly could come and stay in my house, so we weren't so dependent on all of the care I provide to Holly's mum and dad being in their house. You know, about there's other people in the same situation as yourself, then that would have helped. But now Jack's in secondary school, I'm finding that we're meeting more parents the same as us.
I do wish we got accepted more in the hospital rather than seeing the vent and all of a sudden being, no, he's not HDU patient, but he's got a vent, he doesn't need to be in. We get admitted, the minute we're admitted they want him discharged because the vent's taking the bed up and he's not a HDU patient. It's the story of our lives and it's not really good. You know, we look after him at home and all we want is when we need it is that bit of support to help us get over whatever illness it is without being told he's not a HDU patient because of a ventilator.
I'm not a nurse, but I'd love to be recognised for the amount of work that goes on at home, like so many other mums and dads and families. The amount of medication, the care that's received by our young people and children just isn't recognised.